All right, so we're going to talk about fluoroscopic prep, specifically in the case of an upper GI and an esophagram. So on this week's comp, we're going to do those two together. So I'm just going to tell you what I need for you to do. So we got an order for an esophagus as well as an upper GI. So we're going to do both on a patient today. So what you would do in a facility is you come over and you find their protocol list and you pull it out, and then it would tell you a list of items that you need to grab. So in this case, we know we're going to have to drink, right, to get the esophagus. So we're going to grab a straw for our patient, and we are going to get a cup and then a small cup for gas crystals, and we're going to use thin barium today because we are doing double contrasted upper GI, okay? For the single contrasted esophagram, you would want the thick barium. So I don't think I have that in here with me, so just keep that in mind. It's usually in like a blue bottle. So it would look more like this, which looks significantly more dense and it's heavy. So that's the thick barium, okay? So this is kind of what you're gonna have prepped in terms of the contrast you might need. You might, at some facilities, have a little glass of water too, okay? So gas crystals, a cup for the esophagram or whatever they need to drink, thick barium and thin barium. So that's what you need for that. And then you want some lead ready. So you would grab this for your radiologist. Most radiologists have specific lead that they use, and then grab some for yourself and any students or job shadowers that might be with you. So you'll have that ready, and then you need to, that's the room prep and equipment prep. Then you need to go get your patient and make sure she's prepped. So we'll just kind of role play with Bailey here, how that might work. So I'm gonna come out to the waiting room. Bailey?
Hi.
Hi, I'm Jeremy. I'll be
Hi.
your technologist today.
Okay.
How are you?
Good. How are you?
Great. Great. Can you give me your full name and your date of birth, please?
It's Bailey Waymeyer, 1228 of 98.
Awesome. Come with me. You know what we're doing today?
Yes, I do.
Okay. What is it?
We're doing a fluoro swallow.
Yeah, we're gonna do a few different studies. What kind of issues have you been having?
I just feel like when I swallow, it just doesn't go all the way through. I just having some pain and stuff like that.
Okay. How long has that been going on?
Just a couple weeks.
And where's your pain again? I'm sorry.
It's like
Right there?
here. Yep.
Any chance at all that you could be pregnant?
No.
All right, great. So let me explain kind of what we're gonna do, all right? The doctor's ordered an esophagram, which is a study basically from your mouth to your stomach, and then upper GI, which is a study that details your stomach all by itself, okay? So altogether, we're talking 35, 40 minutes for the entire procedure.
All right.
The way that this works is, I'll take a quick picture just to make sure we can proceed. I'll go talk to Dr. Jones, our radiologist, and he'll tell me if we can go or not. So we'll know that here in just a second, okay?
Okay.
I know you're probably ready to eat, so we'll find that out.
Yeah, I'm hungry.
Right? When was the last time you had any food?
At dinner.
Okay.
At a meal dinner.
Okay, so you haven't had anything today at all?
No.
Okay, and it's 8 a.m. All right, so, all right, so we'll do that. That's called a scout. We'll take a quick picture, talk to Dr. Jones, and he'll tell us we can proceed. At that point, I'll just get you all set up, and we'll get started. Okay, if you look over here, this stuff, have you ever had it before?
No.
Okay, that's barium. It's delicious.
Mm-hmm.
It's not delicious. So, but you do have to drink some of it, okay? But it's temporary. It'll pass through. No big deal. The body doesn't interact with it, so it shouldn't really affect you, okay?
Okay.
So you'll have to drink a bunch of that. Unfortunately, it's not the best stuff. You'll lay on the table. We'll stand it up, and then we'll move you around, and we'll take some pictures, okay? When Dr. Jones is done, he'll leave, and then I'll take some pictures with my camera, and then we'll be done, okay? All in all, like I said, 35 to 45 minutes, something like that. Do you have any questions for me?
No.
All right, great. We'll go ahead and get started.
Okay.
I'm going to have you step in the restroom, take everything off from the waist up and put a gown on that ties in the back, okay?